So what are the contents which will be covered in this session? So we will be knowing what is MCH, that is maternal and child health. What are the various objectives of maternal and child health? Why is that there is so much focus given everywhere on maternal and child health? What is social obstetrics and social pediatrics? What do you mean by preventive pediatrics? The various statistics in relation to maternal and child health and the maternal and child health important problems. So this is the various heading which will be taken in this session. So what is MCH? MCH is nothing but maternal and child health services. So it is a promotive, preventive, curative, rehabilitative healthcare for mothers as well as children. So along with that, it also includes family planning, school health, and services for the handicapped children as well as adolescent health. So this is what maternal and child health services include. So coming to the objectives, what are the objectives, main objectives of maternal and child health services? One and the most important is reduction in the maternal, perinatal, infant, childhood mortality and morbidity. You know that the mortality is the death rate, the morbidity is the disease or the sickness rate. So maternal deaths, that is the number of deaths among the pregnant mother along with delivery up to 42 days following delivery is considered as maternal death. Perinatal. Perinatal includes the death of the neonate, that is after 28 weeks of gestation up to the first week of birth, that is the 7 days after birth, that is perinatal. Infancy includes the infant age from birth to 1 year of age, and childhood mortality is from 1 year to 4 years of age. So you should be knowing the various terminology which will be explained in the further class. Just for you all to know the difference between perinatal and infant, I have just given you that introduction. So the main objective is to reduce the maternal, perinatal, infant, childhood mortality and morbidity, promotion of reproductive health. So reproductive health is given a lot of importance in MCH services. Promotion of physical, psychological development of a child and adolescent in the family. So it includes the overall health of the mother as well as the child, and hence these objectives have been framed keeping that in mind. Now, why is mother and child considered as a single entity? Can we not separate a mother services differently as well as giving the child services differently? This is used to happen in the past, but they have understood that since the mother and child is a single entity and you cannot separate them, the services are provided for both of them together. So MCH, that is a maternal and child health services, are closely linked, that each has a capacity to influence each other. So mother takes care of the child. So to provide the child the various health services, she goes to the health center. During the same time, that opportunity can be taken into consideration and the health services can be provided to the mother too. Hence, these services are combined together. And if you look at the outcome of pregnancy in terms of healthy newborn, it's totally depend on the mother's health. So if the mother is healthy, you can expect to have a healthy child most of the time. So it depends on the mother's physical status, psychological status, the mental status, the nutritional status of a mother during the pregnancy and much before that. That is during the adolescence itself. If they are healthy during the adolescence, they continue to be healthy during their pregnancy also. So it is very important to keep in mind the health of the mother if you want a healthy child in the future. Some specific health intervention jointly protect both the women and their babies. Examples here given is tetanus toxoid immunization. So if a mother is being immunized against tetanus, so is the neonatal tetanus is prevented in the newborn child also. If the nutritional status of the mother is improved, the baby born also will not be a low birth weight. So on and so forth. So mother and child is considered as a single entity. Now, why is that? There are so many groups like the females in the adolescence, the reproductive age group women, and then pediatrics, and so on and so forth. Why is that there is so much focus being given to maternal and child health services alone? If you look at the statistics, the mothers who are in the reproductive age group, that is 15 to 45 years of age, they constitute around 20 to 22% of the total population. And if you look at children under 15 years of age, they constitute around 40% of the total population. So if you include both the mothers in the reproductive age group as well as the children less than 15 years of age, they constitute a majority of the population, almost 60 to 70% of the population. This is in the developing world. And they are also the most vulnerable section of the society. That is, they are the weaker section of the society. So they are at risk of death, disease, disability, as well as gender discrimination. That is why there is so much attention to maternal as well as child health. So the women as well as the children represent the economically dependent group as well as the least empowered section of the society. So there is attention to these group, and most of the deaths which occur among the mothers as well as the diseases which occurs among the reproductive age group women as well as among the children less than 5 years are mostly preventable, that too in the cost effective manner. Hence, so much attention has been given to maternal and child health. Now coming to obstetrics, you know what is obstetrics. Now what is social obstetrics? So social obstetrics is largely a preventive medicine. So it is mainly preventing the health conditions among the mother so that the mother is healthy throughout the pregnancy, puerperium, as well as after delivery, and she gives birth to a healthy baby. So there is, at the end, there is healthy mother as well as the healthy baby. So initially they thought that OBG is only related to antenatal care, intranatal care, postnatal care. But now it is, that is a very old concept. Now it is replaced with community obstetrics, which combines the obstetrics along with the primary health care. Hence, social obstetrics is a branch of preventive medicine, and it is defined as a study of interplay between the social environmental factors and human reproduction factors due even right before the preconception and the premarital period. So these social and environmental factors influence the human reproduction and thereby the birth of the baby. For example, the various social factors play a role in the health of the mother and the baby includes the age at marriage. If the mother she is married at an early age, then the risk of she having various problems during her pregnancy and childbirth is high. And if the number of birth children the mother is having is 4, 5, again the risk is high. If the child spacing, that is the difference between two children is not more than 3 years, again the risk of the mother going through various complications is high during pregnancy. Also the family size, the level of education, the mother's economic status, the various custom, the belief the family follows, all included in social obstetrics. So it is an social and environmental factors in relation to human reproduction, that is social obstetrics. Now what is social pediatrics? Social pediatrics is also a part of preventive medicine itself. So it is the application of principle of social medicine to pediatrics to obtain more complete understanding of the problems of children in order to prevent and treat and promote their adequate growth and development through an organized structure. So no more pediatrics is dealt with only a sick child coming to an OPD and with immunization and so on. So the various social factors involved in the growth and development of the child as a whole is also taken into consideration, and these factors are also tackled for the overall development of the growth in children. So that is includes social pediatrics. In other words, social pediatrics is the delivery of comprehensive and continuous health care for the child to bring the service within the reach of the total community so that it is accessible as well as acceptable in the community. That is social pediatrics. Now, preventive pediatrics. So, preventive pediatrics, it is the main component is prevention and social medicine. So, it is a comprehensive care of children, which includes various things of, as I told you, that is the social factors and the things which can be prevented. So as I told you, the number of deaths as well as the morbidity among the children can be reduced to a drastic level by knowing what are the conditions which causing them, and if you prevent them, so you can reduce those things like the growth monitoring, regular growth monitoring, providing nutritional supplements, promotion of breastfeeding, immunization, and regular health checkups, providing them ORS, and so on and so forth. This is going to have a long effect to bring up a child who is fully developed as well as grown to their potential. So that's what preventive pediatric includes. So now coming to the various statistics in maternal and child health. Now first I would be talking about the global picture and then followed by Indian scenario. To talk about the number of pregnancy occurring all over the world, around 214 million pregnancies occur each year, every year. In this, around 46 million end up in induced abortion. So you can look at the numbers. Around 46 million almost come up to 13 to 15% of the same undergo induced abortion. And unprotected deaths occur during pregnancy, either during times of pregnancy, during the time of delivery, or following delivery. So if you look at the total number of deaths annually occurring worldwide is 295,000 maternal deaths occurs worldwide, and of which 68,000 deaths is attributable to unsafe abortion. So if you look at the total number of deaths occurring among the mothers, and if you look at the deaths due to unsafe abortion, it's quite high, 68,000. In this is the statistics of the year 2017. And the maternal mortality rate worldwide is 260 per 1 lakh live births. You must be noticing that everywhere we will be using 1,000, for 1,000 live births, whereas in case of maternal mortality rate, we would be using per lakh live birth. This is the thing which you should keep it in mind. Can you all mute the phone? Okay, we were in this slide. So the total number of death, as I told you, worldwide is 295,000, and the deaths only due to unsafe abortion is around 68,000, and the maternal mortality rate is 216 per 1 lakh live births. And if you look at the statistics of the babies being born stillborn, that is the death of the newborn after 28 weeks of gestation, just before birth, So there is 3.3 million babies who are stillborn. More than 4 million babies are dying within 28 days. So from birth to 28 days, they are called as neonatal deaths within 28 days. And that is accounting for 4 million. And if you look at children dying before their fifth birthday, every year there are around 6.6 million dying before they complete their fifth birthday. So the statistics, this is for the global statistics. Now coming to the Indian picture with respect to maternal and child health, if you look at the sex ratio, that is the total number of male to female ratio. So for every 1000 males, we have the female ratio being 933. So it is very low. So this is mainly due to female feticide, so more preference to male child, so on and so forth. So the sex ratio is low. And if you look at the age at marriage, the median age at first marriage, women, most of them are the average age is around 17.2, though the government has fixed that the age at marriage is 18 years. And what is the knowledge about the women on the contraceptive methods? They have a very poor knowledge about the contraceptive methods, and also they are not delaying the first child, and also the spacing of the second child is also not being done because their knowledge on contraceptive is poor. And if you look at Indian scenario, the total number of maternal deaths account for 44,000 in total. This is for the year 2017. And if you look at the maternal mortality rate, it is around 130 per 1 lakh live births. I have not gone into the statistics of the total of the other states. I have only looked into the India as a whole, and then I have given the statistics of Karnataka. If you look at Karnataka, the maternal mortality rate for Karnataka is 108 per 1 lakh live birth. And the infant mortality rate, that is the death of infants less than 1 year of age, from birth to 1 year, it is 34 per 1000 live birth. This is the statistics for 2016. That is how many child of 0 to 1 year are dying for every 1000 live birth. This is the statistics which you will be reading in the further classes. So this is around 34 per 1000 live births. And if you look at the rural and the urban difference, the rural area is high compared to the urban areas. And for the Karnataka, the statistics for infant mortality rate is 24 per 1000 live births. Continuing with the same scenario, if you look at the various services provided by the government and the services accepted by the ANC mother, we have minimum of 4 antenatal checkup to be given to the pregnant mother. If you look at the statistics, less than 50% of the women receive the full antenatal care during their pregnancy. And now the number of institutional delivery has gradually increased. Now we are having 79% of the total deliveries occurring in India in institution. And the delivery conducted by skilled person has also increased. That includes the doctor, the nurse, ANMs, LVH, and so on. All these people, they include the skilled person, and that includes 81.4%. And if you look at the disposable delivery kit, even there is some percentage of home deliveries occurring. Among them also, the disposable delivery kit is being used only in 20 to 30% of them. And if you look at the number of women after delivery having a postnatal checkup within 2 days, it is only 37% of the mothers are having a checkup. So this is also very less. So these indicators show that how well there is the acceptance of the health services and how good are the services being provided to the mother as well as the child. The infant mortality rate, as I told you, for India is 32 per 1000 live birth, and for Karnataka it is 24 per 1000 live birth. The infant mortality rate is higher in the rural area as compared to the urban areas. That is because of the infrastructure present in the rural area and the presence of the medical faculties and the various technologies available over there to provide the services to the mother. So the maternal and infant mortality higher in rural area compared to urban area, and the death due to low birth weight alone of all the deaths, if there are 100 deaths and if you account for only the low birth weight, it accounts for around 57% of the total death among the infant mortality. That is why so much importance is given to low birth weight. Low birth weight is the birth weight of the baby. It should be above 2500 grams or 2.5 kgs at birth. If it is less than 2.5 kgs or 2500 grams, the baby is said to be low birth weight. It is one of the important indicator. It itself will tell us the future of the baby, whether the child will have a high risk with respect to mortality and morbidity. Hence, the birth weight of the child is a very important factor to be considered. Then, if you look at the under 5 mortality, that is the number of deaths dying less than 5 years of age, it is around 40 per 1000 live births. And if you look at the percentage of children who are vaccinated for the vaccine preventable disease, though the government have been giving the vaccination free of cost for all the children up to 5 years of age, in spite of that, the immunization rate for children vaccinated in the age group of 12 to 23 months is only 65%. So still we have a long way to go to provide immunization to all the children in the age group of either less than 1 year or up to 5 years of age. As I told you, the initial objectives of these MCH services to reduce the morbidity, mortality, improve the health services, and so on and so forth. So the various indicators which has been planned, and what have we achieved right now. So look at the infant mortality rate. The infant mortality rate, the 10th plan goals, that is from 2002 to 2007, it was to achieve 45 per 1000 live births. So that was the plan. We have already achieved, as we are 32. And according to RCH, that is Reproductive and Child Health 2, the target was 35 per 1000 live birth. To achieve, it was in 2004 to 9. It was 34 per 1000 live birth. Now we are 32. That is also we have achieved. According to National Population Policy, we had to achieve 30 per 1000 live births by 2010. We didn't achieve by 2010, but right now we are in the line to achieve 30 per 1000 live births. Now coming to under 5 mortality rate, it was a goal to reduce the mortality by 2/3, and now we are around 40 per 1000 live births. Now maternal mortality ratio, the various plans in the 10th, it was around 200 per 1 lakh live births. In RCH, the plan was 150 per 1 lakh live birth, and according to National Population Policy, it is around 100. We need to still achieve the target of 100 per 1 lakh live birth. Now coming to the important problems, that is the MCH problems. Now what is the maternal and child health problems? Now if you look at the problems in the developing nation as well as in the developed nation, the problems are totally different. In the most advanced country, they are mainly concerned with the problems like perinatal problems, like the congenital malformation, genetic and certain behavioral problems. That is the main problems which the developed countries are focusing in the MCH problems. Whereas the developing countries like us, we are mainly focusing in reducing the maternal and childhood mortality, mainly by focusing on family planning, spacing the pregnancy, limiting the family size, preventing the communicable disease, improving the nutritional status, promoting the acceptance of health practices. These are the main things we are focusing on. So the maternal and child health problems in the developed as well as the developing countries are not the same. It is two different things. So their focus is on different issues and our focus is on different issues. The three important things, the triad of maternal and child health problems include malnutrition, infection, and uncontrolled reproduction. These are the triad or the problems of MCH. That is, I'll repeat, it's malnutrition, infection, and uncontrolled reproduction. Now let's talk about malnutrition. Malnutrition is a spectrum and it is an iceberg phenomena. So you can only see the tip of the iceberg, but what lies beneath you cannot see. So it is a huge portion which lies beneath the water. So what we see is just the uh, tip of the iceberg. So malnutrition represents the iceberg phenomena. The pregnant mothers, the nursing mothers, children are most vulnerable to malnutrition. So how can we um, solve these problems? How should we tackle these problems? So it is just it, since it presents as an iceberg phenomena. So just focusing during the time of pregnancy or during the nursing or when the child presents to you during the OPD visit is just not sufficient. We need to follow up them. There must be a nutritional surveillance and there must be a regular follow up of these mothers as well as children right from the adolescence so that they don't end up being a malnourished mother during the time of birth and they don't give rise to a baby who is low birth weight. So malnutrition, maternal malnutrition, what does it result to? So maternal malnutrition can result to toxemia of pregnancy, can result to postpartum hemorrhage, and this can lead to high maternal morbidity and mortality. So intrauterine period of weaning are also very important regarding nutrition and effects on both the mother and the baby. So that is why the spacing is very important. So when there is spacing between the two children of minimum of 3 years and above, so the mother gets a chance to nourish herself well, so that to replenish the body stores, so that she is well prepared for the delivery of the other child. Instead of that, if she is having a subsequent pregnancy without giving a break, then she is not fit enough to give birth to a baby. She ends up with complication. Also, she gives rise to a baby who is of low birth weight, and the complication in the baby as well as mother also increases. So there is direct intervention of improving the nutritional status of the mother as well as the child, as well as indirect intervention of improving the nutritional status of the child. How we can provide supplementary feeding by providing iron and folic acid, by fortification of food, by giving them nutritional education, and also by controlling the communicable disease. See, malnutrition is a vicious cycle between infection and poor nutrition. Once a mother or the child, particularly the child, if they are malnourished, then they are highly prone for infection because their poor nutrition status have got high affinity to get the sickness. Once they're sick, the nutrition status again falls below, so the infection leads to low reduced nutritional status. The nutritional status being low leads to infection, so that becomes a vicious cycle. So prevent the communicable disease through immunization, giving them clean and safe drinking water, and the woman should have a choice for family planning, and she should be educated, and she must be made educated to access the primary health care for herself as well as the children. So the direct as well as the indirect causes of malnutrition must be addressed to solve the problem of malnutrition in the long run. As I already told you, the direct interventions is directly giving the food supplements. If the national programs are over in that ICDS, it has been told that supplementary feeding is being given to both the pregnant mother as well as the recently delivered mother, and even for a child up to 6 years of age, and food fortification with vitamin A, iodine, all these things. Indirect, as I've already mentioned, these indirect intervention play a long it is very important in the long run to improve and reduce the malnutrition status in both the mother and the child. Now coming to infection, as I told you, infection is also one of the important problems among the maternal and child health. So the important problems in terms of infections are growth retardation, that is a fetal growth retardation due to infections in maternal infection that may lead to low birth weight. As I told you, low birth weight is nothing but the baby weighing at birth less than 2.5 kgs. The infection in the mother may also lead to abortion. It may lead to sepsis. In our country, the infection rates are very high, whereas in developed countries, the infection rates are very low, significantly. And Other infections in the mother like HIV, hepatitis B, and infection with cytomegalovirus, herpes simplex virus, or toxoplasma during pregnancy. That is the torch agents. Infection in the mother due to torch infections can also lead to infections and complications in the neonate in terms of congenital malformation or other birth defects. That was the infection in the mother, whereas the infection is the baby. The infection can be acquired during the time of labor or time of delivery or during when the child is growing. So usually the child up to 6 months of age will not have any sort of infections at large because of protective antibody from the mother. And after the 6 months of age, when there is protective antibodies have weaned off, and then the child is exposed to various food in terms of complementary feeding, and the child is exposed to various things, then the child may suffer from various infections. Among the infections in the children, the most frequent one are the acute respiratory infection, diarrheal infections. The child can have tuberculosis and neonatal tetanus. This is in the early childhood life. There may be other infections also in the early childhood, like the measles, mumps, rubella, diphtheria, pertussis, hepatitis B. So to prevent that, there is universal immunization program which is being provided at a free of cost by the government to prevent all the vaccine preventable diseases. So the mothers and the family must be educated to take care of the child by bringing them to the primary health center at regular intervals and getting them vaccinated against the vaccine preventable diseases. So we have done with malnutrition as a problem, infection of the problem in the mother as well as the child. Now we are talking about uncontrolled reproduction. So the uncontrolled reproduction, why is that an uncontrolled reproduction a problem under maternal and child health? So unregulated fertility is one of the important condition which has increased the prevalence of low birth weight and chance of anemia in the children and high chance of abortion, and this is unplanned. So when the pregnancy is planned, then the mother takes care of herself in terms of the nutrition, healthcare services, getting the immunization for herself and various other things. When the pregnancy is not planned and it is unregulated, the prevalence of various other things goes up. That is the anemia among the mother, abortion in the child, the antepartum hemorrhage, the postpartum hemorrhage. This also leads to a higher level of maternal mortality rate and infant mortality rate and high under 5 mortality. So if there are various methods of controlling the reproduction. One of the ways of controlling reproduction indirectly is increasing the age at marriage. If a female, instead of getting married at 15 years of age, she is getting married at 18 years of age, we are uh, not allowing her to become pregnant early by these laws and regulation, and we will be postponing her pregnancy in one way by these rules and regulations. And then through spacing, when there is minimum period of spacing advised in the mother, so the number of pregnancy also comes down drastically, and thereby we are indirectly reducing the various morbidities and mortalities which occur in the child as well as in the mother. So measures under to control the uncontrolled reproduction includes integrated family planning, provision of newer contraceptive, and which provision of safe MTP methods, providing oral contraceptive pills. MTP is medical termination of pregnancy. When the pregnancy is unplanned, most of them end up with unsafe abortion by going to quacks and ending up having abortion in an unsafe manner. During this time, there is death, not only there is abortion, but also there is high risk to the mother. The death rates are also high in case of unsafe abortion. So they should also be having access to the family planning services free of cost, and there must be a continuous education being provided to all of them so that they take a informed decision about their family to so that they can decide how many number of children they can have, when they can have, and they can reduce various problems among the mother and child indirectly. Okay, now we are talking about the various challenges in the maternal and child health. So we know that what are the various statistics globally and Indian scenario. We know now what is social obstetrics, what is social pediatrics, what is preventive pediatrics, and we know the important triad in MCH includes the malnutrition, infection, and uncontrolled reproduction. Now, what are the challenges in the maternal and child in providing the maternal and child health services? There is lack of universalization of services. So the services are not universal everywhere. There is a difference between the rural as well as in the urban area. Okay, so we were in the challenges in providing the maternal and child health services. So there is no universalization of services everywhere. So there is lack of universalization. So we need to see that the services are provided universally everywhere throughout the country. So there is a difference between rural and urban scenario in terms of the morbidity and the mortality. We need to see that various infrastructure and the manpower and the financial requirement is provided, and the difference between the rural and urban is reduced. The status of the women in the society is very poor. We need to see that the women are empowered, they have their voice, they take a firm decision along with their family member to decide the number of children they have and to access the healthcare services when and so required. And there is also lack of political will and acceptance of the issue as a social priority, though they constitute the mother and child they constitute around 60% of the total population. There is not much of a priority given to this issue. The main challenge is as child survival is ensuring that the services and education required for these solutions reach the most marginalized countries and communities. So we are talking about provision of services and education of the mother and things like that. But these are mainly the tertiary care hospital and various other private sectors or the doctors availability are mainly seen and oriented in the urban sectors compared to the rural areas. So the challenge is to provide them in the most marginalized group and difficult to access group so that the needy gets what they want instead of giving it to those who are already having those facilities. Now, those were the challenges in maternal and child health. Now, coming to the opportunities and maternal and child health. So it is a continuum of care. So maternal and child health is not only providing services to the pregnant mother and giving services only to a newborn child. So it is a continuum of care and need to focus on two dimensions, that is to provide essential primary health care services mainly at the time when it is required and the place it is much required. So we need to see that the adequate services are timely given, that is the ANC registration, the new nutrition supplementation, the delivery services are provided. If there is registration of a woman, we can follow her up and see that the delivery services are provided, and follow up the same after the birth of the child, promoting the mother to breastfeed the child, follow up with vaccination, nutritional supplementation for the child, then followed by growth monitoring. So it needs to be a continuum right from the adolescent, pregnancy, childbirth, reaching up to fifth year of age, completing the vaccination, and so on and so forth. And also including the family planning programs during these health checkup. When the mother comes along with the child for immunization, the family planning service can also be provided, so that the uptake by the mother for family planning services is very high. And the place, so we should not be giving these services separately. It is though it is integrated, so it should be giving together. So, the delivery of essential services, that is the primary health care system that integrates the community and outreach and facility based care. So, it should not be only a facility based care, it should also be a community outreach. ICDS is one of an excellent example by providing the services to the child in at the community level, so that the acceptance by the community is also very high in terms of the immunization or supplementary nutrition or informal education. Everything goes on, so it should be the services being provided, it should be integrated services to be provided for both the mother and child at the right time and at the right place. So these are the very important, this is an opportunity which can be taken up in MCH services. So take home messages under MCH is that we need to focus, it is a continuum of care. It is just not a focus on the mother during pregnancy or just the childbirth, right from adolescent health care and the marriage at appropriate age and the childbearing at appropriate age. They should be an integrated service to both mother and child. And social factors, one of the important factors which plays an indirect role in the causation of diseases, which must be addressed, which can be addressed in terms of social pediatrics or social obstetrics. And community medicine plays an important role in addressing these issues and providing a link by providing various statistical data at the community level to the obstetrics as well as the pediatrics, and improving the continuum of care throughout the reproductive life of a woman or a childhood life of a child. So this is very important. So MCH is just not taking care of the sick mother or a sick child, it is the take care of a healthy adolescent and she becoming pregnant and giving birth to a healthy child in the future. So it is a continuum of care which needs to be focused at the community level, not only at the facility level. Thank you. Is there any questions for me? Are you all there? Is there any questions for me?